All 9 of the WHO-sponsored systematic reviews published to date in a special issue of Environmental International suffer from serious methodologic problems and seem biased to dismiss the substantial evidence of health risks reported in the peer-reviewed scientific literature. Earlier this month, the WHO Commission Review of Human Cancer Studies was published online. The paper received worldwide media attention because the paper's first author, who also happens to be the vice chair of ICNIRP, proclaimed in a press release, quote, "We can now be more confident that exposure to radio waves from mobile phones or wireless technologies is not associated with an increased risk of brain cancer," unquote, and that, quote, "radio waves from wireless technologies are not a hazard to human health," unquote. Numerous problems with this paper are discussed on my saferemr.com website. The most informative results should have come from analyses of the tumor risk associated with the total amount of time on cell phone calls. The study found that after about 500 hours of cell phone call time, the risk of glioma and meningioma increased with increased call time. However, these results were not statistically significant, we believe, for 2 reasons. The authors employed a complex model with limited power to detect effects, and the original studies had relatively few users with substantial call time. In contrast, in our 2020 review paper, we combined studies of different tumor types and found statistically significant increased risk for tumors in the brain and salivary glands after 1,000 hours of cumulative call time. The odds ratio was 1.60. Our systematic review was by no means unique. 4 other systematic reviews and meta-analyses and several other review papers published in peer-reviewed journals since 2016 also found substantial evidence of an association between long-term heavy cell phone use and brain tumor risk. Hence, due to organizations like ICNIRP and ICBE, the Institute of Electrical and Electronic Engineers, the scientific controversy over the health risks of RF radiation is likely to continue for some time. Meanwhile, our exposure to radiation is likely to increase exponentially due to employment of many more wireless devices and the infrastructure to support them. ICBE-EMF's first paper recommended ALARA, A-L-A-R-A, which means that RF radiation exposure should be kept as low as reasonably achievable. For safety tips on how to reduce wireless radiation exposure, see my website, saferemr.com, which includes a link to cell phone safety guidance issued by the California Department of Public Health and other organizations' safety tips. To reduce the risk of harm, individuals should adopt the following behaviors. First, minimize your use of cell phones and cordless phones. Use a landline whenever possible. Second, distance is your friend. Keep your phone 10 inches from your body as compared to 1/10 of an inch results in a 10,000-fold reduction in exposure, inverse square of the distance. So keep your phone away from your head and body. Store your phone in a purse or backpack, and text or use a wired headset or speakerphone for calls. Third, cell phones are programmed to increase radiation when reception is poor by a factor of up to 10,000 times, in fact. Thus, use your phone only when the signal is strong. Avoid using it in an elevator or in a vehicle as metal structures interfere with the signal. Finally, turn off the wireless devices at bedtime, including your Wi-Fi router. Better yet, use wired connections, not Wi-Fi. Cable, Ethernet, or optical fiber are faster, more secure, and safer than 4G or 5G. In conclusion, I believe that we are guinea pigs in a massive technological experiment that threatens our health. Our government must fund the research needed to determine a safe level of wireless radiation exposure and strengthen the FCC's radio frequency exposure limits. In the meantime, the government should impose a moratorium on technologies that increase our wireless radiation exposure, especially to new forms of wireless radiation like 5G. Here are some resources which appear on this slide with links, and finally, my contact information. Thank you.